Hello, and welcome to One World, One Health, where we take a look at some of the biggest problems facing our world. I'm Maggie Fox. This podcast is brought to you by the One Health Trust, with bite-sized insights into ways to help address challenges such as infectious diseases, climate change, and pollution. A One Health approach recognizes that everything on this planet, the animals, plants, and people, and the climate and environment are all linked. Flu never fails to surprise us. Every few years, a whole new variant of flu pops up and gradually adds itself to the mix of different flu viruses that infect people and animals to varying degrees. The latest surprises come from H5N1 avian influenza, or bird flu. It's been spreading among new animals and in new places, including in Antarctica, and now among dairy cattle in the U.S. And then it appears to have infected someone who was in contact with these milk cows. Dr. Richard Webby is an expert on the interspecies transfer of viruses when a virus passes from one species to another. He's been watching H5N1 for decades now. Dr. Webby's director of the World Health Organization Collaborating Center for Studies on the Ecology of Influenza in Animals and Birds at St. Jude's Children's Research Hospital in Memphis, Tennessee. His center is also designated the Center of Excellence in Influenza Research and Surveillance by the U.S. National Institutes of Health. He's one of the world's top experts on the weirdness of flu, and he's here to chat about what H5N1 is up to. Richard, thank you so much for joining us.
Oh, thanks, Maggie. It's a pleasure.
How surprised were you when you learned that H5N1 had been found among dairy cattle in the U.S.?
Yeah, so maybe this is going to destroy everything you just said about how much of an expert I am, because I could have sworn that this virus was not going to turn up in cows. So from that perspective, yeah, it's a really surprising event for me. Perhaps not as surprised as I should have been. Yeah, there have been a few reports over the years of hints that maybe cows have been infected with flu A viruses, but this was a surprise to me.
Does that indicate it might be infecting other animals that we might not be aware of?
Yeah, I think that's probably likely. If we look at what this virus, and by this virus, what I mean is the current form of this H5 bird flu, avian flu virus, whatever you'd like to call it, it's been around for close to 25 years now. But the one that's been circulating over the past couple of years has infected a number of different hosts. It's not just cows. We've seen it in dolphins and porpoises. Again, animals we didn't know should be infected with flu. And so it's almost certainly that this virus is infecting other animals. Probably not many. They're the one or two or three or small numbers that we just haven't seen.
You say this version of the virus. What changes has it made over the past 25 years?
So this is a flu virus, and flu viruses never stay the same for long. So over the 25 years we've been following the virus, if you actually look, when we say it's the same virus we've been following for 25 years, that's not really true. It's got parts of the same virus we saw 25 years ago, but most everything else about it has changed. So flu viruses interact with other flu viruses, they mix genetic segments, they change, they evolve. If you think like COVID and the variants that keep on popping up, flu does exactly that. So it's changed a lot over the past 25 years.
Bird flu, even with the changes, it only occasionally infects people, and it seems to be only usually through direct contact with an infected animal. I'm thinking of the children who tended poultry who were among those infected in the past. If it shows up in farm animals, though, does that suggest there might be a return to more risk to people?
Yeah, I think if you want to put what we're seeing now in cows sort of into perspective of risk for the human population, yeah, I think that is the one thing that is elevated risk. We are getting potentially more people exposed to an infected animal. Prior to this, the mammals that we saw infected were a lot of wild mammals, so foxes or bears or mountain lions, etc., that stumbled across probably a sick or dead bird and got a huge amount of virus and got infected. And of course, the exposure to people to those animals is low. If this virus continues to circulate within cows, and even though it's still an avian virus with low risk to humans, there is more exposure. So even just by a numbers game, it increases the risk.
The patient in Texas apparently only had conjunctivitis, which is a pretty mild symptom. Is that a good thing?
Yeah, I think there's never a good thing about someone being infected with these viruses. But yes, I think the fact that this was sort of an atypical presentation And we have seen in the past when these bird flu viruses infect humans, we have seen this conjunctivitis presentation before. So in itself, not surprising. But I think it is a good thing that it was that rather than a full-blown sort of respiratory disease. And you can imagine, I think in the environments of these milking sheds where from certainly what has been presented, lots of virus potentially in the milk of some of these infected animals, it's not hard to imagine how a splash in the eye or a contaminated hand wiped across the eye could have occurred.
But U.S. health officials are warning that raw milk needs to be pasteurized to be safe. I'm thinking about this small but very passionate movement of raw milk enthusiasts who think raw milk is healthier for them. Is there some kind of risk that a raw milk drinker could catch H5N1 from drinking the milk, perhaps incubate this virus in their body and give it the chance to acquire the changes that it needs to live easily and transmit easily among humans?
Yeah, so I think, Meg, it's a great question. And I think we have to talk about theoretical risk here. And there absolutely is a theoretical risk here. We know there's virus in the milk of the infected cows. Again, first-hand experience here, but everything I've been told, the milk from infected cows probably wouldn't find its way to the human consumption chain anyway because it's a bit thick and I would imagine not particularly tasty. But yeah, that's a concern. We've also got to think, so yes, there could be virus in raw milk. Someone could swallow it. Is swallowing a means to catch this virus? Probably. We don't know that for sure, though. But yeah, as you suggested, the concern is with this virus. Right now, it's still very much a bird virus. It's not a human virus. But the more chance it gets to replicate in humans, the more likelihood it's going to sort of change to become more mammalian-like. So yeah, theoretically, right now, there is a risk. So it's probably not a good thing to be doing.
But that's a good point you make about it changing the milk. So when the cattle are infected, it changes the quality of their milk?
Yeah, and I think that's a good thing. Again, we've got to keep in mind, information is still coming out from this. We're learning new things every single day. But that, at least from the early reports, the milk from the more obviously affected cows, it's clearly got something wrong with it. So, it is being dumped or collected and not going into the milk chain.
Okay, that is reassuring. Can we talk about the changes that the virus needs to make to become dangerous to the human population, right? There's a whole series of these changes.
Yeah, no, absolutely, Maggie. So, yeah, over the past 25 years, a lot of work has gone into trying to figure out what this virus has to do to switch from being a bird virus to being a human virus. And so we know some of the molecular signatures. So when we get the sequences of these viruses, we have a decent idea of where to look at that for hints that maybe this virus is making that transition from bird to human. And some of these affect sort of the biology of the virus. So the flu viruses bind to sugars in the host cell, and flu viruses have to get into a cell to replicate. And those sugars that it binds to in birds are slightly different than the ones in humans. And so this is, I think, the major change we're looking for, that the virus is mutating in parts of its genomes that we know where to look, that suggest it's then being more able to bind to that human sort of sugar. And that's a lot of detail maybe, but I think that's clearly that we're looking at most.
So first, it needs to acquire the ability to infect people. It needs to acquire the ability to move from person to person. And it also needs to acquire changes that make it cause serious disease in people.
Yeah, that's absolutely right. I think, what we've seen, again, over the close to 25 years of following this virus, we're edging up towards 1,000 confirmed human cases of this. We've seen a lot of course, mammals over the last 18 months, 24 months infected with this. I think when there's a lot of virus exposed to a mammal right now, so even though this virus is still a bird virus, it looks and smells and everything we know about it, it's a bird virus. But if mammals get enough virus, so a big dose, so either from eating a contaminated bird, bring in very close contact, or again, maybe in close contact with an infected milk products, for example, you can get that one-off infection. But it's these changes to go human to human to human, that's when the virus clearly has to change. Some of it is that receptors are what the virus binds to on the host cell, but there's a sort of a slew of other markers that we look for that suggest that this virus is changing the way it replicates to make it more able to replicate inside a cell of a human, cell of a cow, for example, than the cell of a bird.
So this speaks to the need for surveillance and experimentation.
Yeah, absolutely. As I said, there's lots we don't know about this outbreak. Most of all, we don't actually know how this virus is going from cow to cow. And there's a number of sort of hypotheses that have been put out. It doesn't look like it's, to me at least, that it's typical sort of respiratory spread directly from one cow to another. I think there's something else going on here. And so I firmly believe that if we can understand more about that, then there's probably many things we could do to stop this. And so understanding that will require sort of surveillance, which surfaces, which animals within these farms are infected, how many cows have been previously infected, but also, moving this to the laboratory as well. I think we can understand, which route of infections could cause disease, and that could actually manifest in the type of disease that we're seeing in the cows now.
When you say you think something else is going on, what do you mean?
I think, again, looking at the type of disease these cows have, again, from everything I've seen, there's large amounts of virus in the milk of these animals, but not much in the respiratory tract. So, how's it getting about? Is it something to do with the milking process itself? It seems to be just lactating cows that are getting infected. So is it something in the process of that? Is it perhaps an infected cow drinking a water source and another cow come along drinking that, or some sort of contaminated machinery instrument that's actually moving it between cows? That's kind of what I'm getting at. So it's clear right now there is cow movement of this virus, but I don't think we can say with any certainty that's actually going directly from one cow sort of directly to the next.
H5N1 has been around for quite a while now, and even though it's been changing, it's never caused the pandemic that so many of us have been worried about and preparing for. When is it going to be time to stop worrying about this virus?
I think that's the biggest problem we have, right? So it's the royal we, but me personally as well. Yeah, we've been telling people we've got to watch out for this virus for a long time, and it's just nothing's happened. And unfortunately, I don't think there probably will be a time, unless we really pull apart these viruses to understand every little detail about how they transmit, where we can say there's no risk. I get asked this question a lot. What I used to illustrate this is there was one particular virus in humans that entered humans in 1968 in the US. There was a virus that spilled over to swine in some parts of the world, but never did in the US until the late 1990s. And then all of a sudden it picked up a different combination of genes, and then it spread widely in the pig population. So that, if you look at that sort of analogous where we are now, that was 30 years where swine were exposed to this virus, exposed to people infected with it, but it took 30 years before sort of the virological stars aligned and it was able to make that leap successfully. So, back to your question, yes, the risk is there. It's really hard to put an absolute risk on any of these, but it's a virus. If there is one flu virus I don't want to personally catch, this one is it.
What other influenza types are catching your interest? What else are you keeping an eye on?
So, if you look at the viruses that have been making that sort of jump from birds, mostly from birds to humans, or even from swine to humans as well, there are a few that always sort of float to the top. The H9N2, we tend to refer to these viruses in sort of a soup of H and N types. And this is a particular virus that's very, very widespread in poultry populations around the world. Every year there's, particularly in Southeast Asia, particularly in China, there's always a few cases of this virus. So this is one that sneaks under the radar a little bit. It doesn't cause as much disease in the bird population, so it's a little harder to track. But that's one that's always out there. And then we do have these viruses that are circulating in swine populations. Luckily, they're much more related to the viruses we have in humans, so they might have a little bit of a harder time pushing into the human population, but again, they're circulating as well. So to me, it's the H5 aside, it's the H9N2s and some of these swine viruses that are of most concern.
It's literally the perfect One Health issue, isn't it? It's something that moves between animals and people and around the whole world.
Yes, absolutely. I mean, flu has always been a little bit of a poster child for the One Health approach. And even in this case, I think bringing the environment factor into this as well, which I think is probably playing a big role here as well. So absolutely, it's animal health, human health, the environment, all coming together in this particular example that's causing the problem we're in.
Richard, thank you so much for such an interesting chat.
You're very welcome, Maggie. Thank you so much.
Listeners, if you enjoyed this podcast, please share it. You can learn more about this podcast and other important topics at onehealthtrust.org, and let us know what else you'd like to hear about at OWOH@onehealthtrust.org. Thanks for joining us.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Lakshminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.